Assalamu alaikum. I hope so you're doing fine. I'm Dr. Mohammed Ali Rabani. Let us talk about the arteries of extensor compartment of leg. So that is basically one major artery that is called the anterior tibial artery. So anterior tibial artery is the one. Let us start for any topic we are discussing. You should be able to discuss on these headings. The original part, the termination part, between them there will be root and relation, and there will be branches that are originating from them. So the origin part. From the origin, we'll see the posterior aspect of leg, the popliteal fossa. So this is the popliteal artery going down, and here it's a termination point, and the artery that is going on the back, that is called posterior tibial artery, and that artery that is going to the front above the interosseous membrane, that is called the anterior tibial artery. So here is the same thing that is shown right here. So popliteal artery on the back, giving anterior tibial artery coming to the front. It goes down, runs in front of the interosseous membrane, and at this point, where an imaginary line joining the two malleoli at this point, so it changes its name from anterior tibial artery to dorsalis pedis artery. There is no anatomical classification, but that is basically based on the surface anatomy or surface landmark. So these are the origin and termination point. And let us talk about the branches first, and then we will see the relations too. So its branches, if you see from the upper end, it gives two branches that going back to the knee. So on the fibular side there is the circumflex fibular branch, and on the tibial side that goes up back to the anastomosis around knee joint, that is the anterior tibial recurrent artery. And it goes down, it gives many muscular branches not shown here, and when it comes down there are two main branches to be discussed that are going to the either side of the malleoli. So these are anterior and posterior, anterior and medial, and anterior lateral malleolar branches. So these are anterior medial, anterior lateral malleolar branches. Here one thing to note here is that on the back, that we'll see in the next lecture, there is fibular artery or peroneal artery on the back posterior compartment. It gives a major branch, that is perforating branch, that joins this anterior tibial artery. So the however small the anterior tibial artery is, the bigger will be the perforating branch, and you will be given a question sometimes that in the absence of the anterior tibial artery, which artery forms the dorsalis pedis artery, so that will be the perforating branch. So we talked about the origin, the termination, and the branches. Let us talk about the root and relations. So the root, we talk about its root. It as it crosses the interosseous membrane, it runs with interosseous membrane, and it goes down till it is converted into this dorsalis pedis artery. So posteriorly there will be interosseous membrane, and you have to memorize which muscles are on either side of it. When it starts on the medial aspect, there will be tibialis anterior muscle. On the lateral aspect there will be extensor digitorum muscle. As you go down to the middle part of the fibula, there is origin of extensor hallucis, that is more medially placed, so the relation changes. On the medial aspect there will be tibialis anterior muscle, but on the lateral aspect there will be on the lateral aspect there will be extensor hallucis. So for the upper parts, tibialis anterior, extensor digitorum. For the middle part, tibialis anterior, extensor hallucis. And sometimes it holds true for the leg, but most of the cases it is for the dorsalis pedis artery. It is this we talked about. You have to keep in mind the oblique running nature of the extensor hallucis tendon. It originates from the lateral bone, that is fibula, but it goes to the most medial aspect, the big toe. So extensor hallucis longus goes like this. When it goes like this, it crosses the anterior tibial artery from lateral aspect to the medial aspect. So in the upper parts, so we will have three pairs of the muscles on either side. On the upper parts we will have tibialis anterior medially and extensor digitorum laterally. In the middle parts we have tibialis anterior medially and extensor hallucis medially. And the lower parts, sometimes true, sometimes but always true for the dorsalis pedis artery, we will have extensor hallucis medially and extensor digitorum laterally. So as you can see, this is the demarcating line between the two malleoli. So this transition is occurring exactly on the spot, but this if this transition occurs right here, we will be able to say that the lower part of the anterior tibial artery is medial to the extensor hallucis and lateral to the extensor digitorum. So this is about that. So and this is about the relations. In addition to the medial and lateral relation, keep in mind the relation of the nerve. Throughout the pathway, the nerve is on the lateral aspect. On the medial and lateral relationship, you will have three pair of muscles as was discussed on the upper, middle and lower part. On the posterior aspect, there will be interosseous membrane. On the anterior aspect, there will be covering muscles, the same one. And when it is crossing into the foot, anterior relation will contain the extensor retinacula, the superior one and the inferior one, including the anterior crossing of the extensor hallucis. So this is all about the anterior tibial artery, starting from the bifurcation of popliteal, ending at medial between malleoli at dorsal spades, giving rise to the circumflex fibular, anterior tibial recurrent, muscular, malleolar branches, getting feeder from perforating branch of peroneal nerve, relations on the posterior aspect, interosseous membrane, on the medial aspect and lateral aspect, three pairs of muscle on the upper end, tibialis anterior and extensor digitorum, on the middle aspect, antitibialis anterior and extensor hallucis longus, and on the lowermost part, there will be extensor digitorum medially, extensor hallucis long medially, and extensor hallucis laterally. And anterior relations, most important will be the extensor retinacula, extensor hallucis tendon that is crossing on the lower end. So that is all about the anterior tibial artery. Next we will talk about the deep peroneal nerve.